We're running a number of IRB studies right now with we have some really rock star physicians that are really into it, and we're partnering with several firms that are in the Qualcomm ecosystem. And so we've got one pilot that it's about to end right now, where we are actually monitoring patients, diabetics, basically with glucose meters, and basically keeping track of their insulin levels throughout the day, and we do this all kind of real time. And the information comes to a nurse coordinator or a physician, and then they can see what having access to that information, which is also accessible not just to the clinicians but also to the patients and their parents. We're doing another one that just started with to manage asthma, and so we use devices from a company called Propeller Health, along with Zephyr, which does heart rate and respiratory rate, and we monitor not only the actual use of the maintenance or rescue medications through the inhalers, but also and the frequency and location and whatnot. But with the respiratory rate and heart rate, and there is a motion sensor, so we're trying to detect cough at night, and the idea is not only to look at the recall but also to see whether, retroactively, by looking at the data from the Zephyr device, we can correlate to use of rescue medication in asthma, and identify whether there are some trigger events that will help us prospectively going forward, then prevent episodes of exacerbation. So that's very cool. And again, those are kind of rock star physicians in our organization that are very excited about this. One of the things that we hear is people see this tsunami of data coming at them, clinicians do, and so the next step, for instance, on the glucose monitoring project, we're getting ready now to go into the next phase, which is how do we get all this massive amounts of data into the clinicians in a way that doesn't overwhelm them. So how do we make it actionable? So we're working with this company called Entra Health, and again, our physician champion for this project. Working with them and us, we're trying to develop the algorithms to filter data so that only actionable data is presented at the right time, and it becomes something useful to them, not something overwhelming. And so once we have that in, then that allows us to be proactive, and the goal, we're really looking forward here in the next 90 days. We expect to see the results from the first phase of the study, because we think, of course, that we're going to see a positive impact by having this information. But we know that in order to scale it, we need to be able to filter the data, make it actionable and within the physician's workflow, so that we can bring it straight into the electronic health record and let them take action on the spot.